Strategic workforce planning, which includes workforce planning, was debated in Parliament this week. Voting on Amendment 29 to the Health and Care Bill. This is the NHS, which is not just a fantastic organisation, it is also the largest employer in Europe. Unfortunately, listening to Peter Dowd, MP, and I quote, "The NHS workforce is in crisis." With 93,000 vacancies, the mind just boggles.
The NHS workforce is in crisis.
So Wednesday, 30th of March, into the late evening, the House of Commons debated or considered the Lords' amendments to the Health and Care Bill for the NHS. And whilst doing so, they touched on its strategic workforce planning capability, or lack thereof, I should say. And it was finally recognised that, and I quote Wes Streeting as the current Shadow Health Minister, "Unless you have a plan for the workforce, you don't have a plan for the NHS." This connection is no surprise to the more than 100 organisations that have supported the amendment. I cover this in linking strategy to workforce implications in my strategic workforce planning framework. And it is no surprise to me either, having experience of over 20 years of planning for people, covering the most granular activities down to minutes of statistical forecasting and up to and beyond 100 years. And my experience is not just from the private sector, it includes working in the public sector as well, and even directly from inside the NHS, as recent as last year, as Strategic Workforce Planning Director at one of the largest ICSs to be. And this bill is what will create the legal structure for a systems way of working with integrated care systems, ICS for short, getting a wider remit for their geography. Now, I have seen the challenges and opportunities for strategic workforce planning and have experience of delivering as well as sadly being hindered from delivering. Let's hear Wes Streeting, the current Shadow Health Minister, in his own words.
Because unless you've got a plan for the workforce, you don't have a plan for the NHS.
This is so true, and not a surprise. Take last year's report on burnout in the NHS. It is pointing to the planning as one of the key reasons for the burnout. For me, it highlighted that the interventions are too much gloss and not enough engine. And I see this too often. The presentation becomes more important than the delivery, or fancy theoretical solutions, missing the granularity and detail of real life. Setting strategies can be easy, yet it is too often not made available to the people that need it. And it's when you come to what I, in my framework, call activation, and bring this together with a fundamental governance I have specifically designed, that you will really generate the benefits of any strategy and workforce strategy. Just as I did at the Metropolitan Police many years ago, quantifying the challenge helps to generate the need to find innovative solutions when the worker supply is short. And let me share two quotes from the burnout report. And I quote, Professor Michael Oest described the people plan as a very smart looking car, but without an engine, because it did not provide detail. And he then later goes on, the direction of travel is excellent, but more detail was required, particularly around workforce strategy, end quote. And the professor was not alone, as the burnout report continues. The absence of detail on the workforce strategy was a concern for a number of our witnesses. The King's Fund described the people plan as another stopgap that falls a long way short of the workforce strategy needed, while the Royal College of Nursing said that a fully funded, fully costed and modelled workforce strategy was needed to ensure that the substantial gaps in the workforce are filled, end quote. The strategy is, of course, a key starting point, and it needs to be anchored in reality and what is possible to achieve with available resources. You really can't, or I should say shouldn't, build a strategy without an understanding on how much work all the output will require. You will have to prioritize and take tough decisions, and this is where transparency will be critical. And it is not just, as Justin Madders, the ex-Shadow Health Minister of 5 years, points out, a glossy document or strategy that is needed.
Justin Madders.
Thank you, Madam Deputy Speaker. I wish to speak to Lord's Amendment 29 to do with the workforce, because the most important thing I learned during my 5 years as a Shadow Health Minister is that everything comes back to the workforce. You can have the grandest plans, strategy documents, reorganisations, integrations and configurations, all of which we've probably got in this bill in various forms, but all of it will count for very little of the fundamental cog in the machine. The workforce is not a central part of those plans, and I believe that the consistent failure to invest in the workforce and to provide a plan for the workforce so that it is able to meet demand over a sustained period is at the root of the challenges that the NHS and social care face today.
One of the things he said, everything comes back to the workforce. Now, one of the most crucial components that has been missing, in my mind, is the understanding and quantification of the demand for health and care services. I don't mean how many doctors and nurses we need. That is too early to say, but how many people will we have in the country and by region? How does their life journey look? And at what points in life will we as citizens need what help, support, care, and healthcare? And how can we reduce this with early interventions? And what additional work will we see if we fail to provide care? Surely, this is the systems thinking the ICSs are created for, reducing the causes, focus where it matters most. And this is prioritization and segmentation. I have seen and experienced firsthand how the public sector is forced to work to a funding envelope, and the political challenge of not being allowed to share how impossible the future may be. And there were plenty of examples in this debate too. I will leave that for another time though, or another conversation if you want to reach out. And just to clarify, the House of Commons voted to reject the Lord's Amendment, and the ping pong is on. The 5th of April is when the Lords are due to sit for considerations of Commons amendments. What I want is to have a clear, transparent projection. Obviously with scenarios, 4 actually, and yes, there is a reason for that. The projections are on all assumptions that leads to real demand, as I mentioned before, and done by and or in collaboration with external impartial support. I would remove the mandatory part to include NHS England and Health Education England. It is more important to include people in the front line. And to ensure the details are there, it needs scrutiny. As such, it must be a published output, and it seems right to have it presented to Parliament. But every year, no, but every 5 years is not good enough by any stretch. When I do strategic workforce planning, I can have as long a horizon as is required. And to quote myself, am I driving a tanker or a go-kart? What I must have is the link to execution, the activation and governance I mentioned. I can show you where we are every month and 4 different scenarios at least of where we're heading, making it possible to consider interventions in time. It also means that when you get a surprise, you are much more able to handle it and handle it quickly. And this means increasing value to the taxpayer, delivering value for money, the thousands, no millions. Well, Jeremy Hunt and others actually said billions we are spending on not using the right supply source, but expensive contingent workers, consultancies and locums, which may not be the best workforce strategy. Well, see you again soon as the ping pong continues.